Welcome to the Neurology channel, your trusted source for all things related to neurology and brain health. Today we have an important topic to explore, rocuronium. Whether you're a patient, a caregiver, or simply interested in neurological treatments, you're in the right place. But before we dive in, be sure to subscribe and hit the notification bell so you never miss our latest updates. Rocuronium is a medication that plays a crucial role in medical and surgical settings, particularly in anesthesia and critical care. In this video, we'll delve into what rocuronium is, how it works, its applications, and why it's important in the field of neurology. What is rocuronium? Let's start with the basics. Rocuronium. Rocuronium is a non-depolarizing neuromuscular blocking agent, commonly referred to as a muscle relaxant. It is used to induce muscle relaxation during medical procedures, surgeries, and in the management of patients in intensive care units. How it works. Rocuronium, like other neuromuscular blockers, works by blocking the transmission of nerve signals to the muscles, leading to muscle paralysis. This paralysis is essential for various medical interventions. Rocuronium is a medication classified as a non-depolarizing neuromuscular blocking agent, commonly referred to as a muscle relaxant. It is primarily used in medical and surgical settings to induce temporary muscle paralysis for various clinical purposes. Here's a more detailed explanation of how rocuronium works for patients. Mechanism of action. Rocuronium functions by interfering with the normal communication between nerves and muscles, specifically at the neuromuscular junction, blocking nerve signals. Under normal circumstances, when a nerve sends a signal to a muscle, it releases a neurotransmitter called acetylcholine at the neuromuscular junction. Acetylcholine binds to receptors on muscle cells, leading to muscle contraction. Competitive binding. Rocuronium competes with acetylcholine for binding to the receptors on muscle cells. When rocuronium binds to these receptors, it prevents acetylcholine from binding and activating them. Muscle relaxation. As a result of rocuronium binding to muscle cell receptors without activating them, muscle contraction does not occur. This leads to temporary and controlled muscle paralysis, which is essential for various medical procedures. Controlled paralysis. The level of muscle relaxation induced by rocuronium can be controlled by adjusting the dosage administered. Anesthesiologists and healthcare providers carefully monitor the patient's neuromuscular function during the procedure to ensure the desired level of muscle relaxation is achieved. Applications in medical procedures. Rocuronium is commonly used for several purposes. During surgeries, including neurosurgery, it ensures that patients remain still and do not make involuntary movements. This is critical for the safety and precision of the procedure. It is used to facilitate endotracheal intubation, which involves inserting a breathing tube into the patient's airway. Muscle relaxation makes this process smoother and reduces the risk of complications. In intensive care units, rocuronium can be administered to manage patients who require mechanical ventilation. It allows for better control of ventilation and ensures that patients receive adequate oxygenation and ventilation. Reversibility. Rocuronium-induced muscle relaxation is typically reversible. If muscle function needs to be restored once the medical procedure is complete, reversal agents such as neostigmine may be administered. Reversal agents counteract the effects of rocuronium, allowing patients to regain muscle function gradually. In summary, rocuronium works by competitively binding to muscle cell receptors, preventing acetylcholine from binding and activating them. This results in temporary muscle paralysis, which is essential for various medical procedures, surgeries, endotracheal intubation, and mechanical ventilation. The precise use of rocuronium is crucial to ensure patient safety and comfort during these interventions, and its effects can be reversed when muscle function needs to be restored. Administration and dosage. Administering rocuronium is a carefully managed process. Intravenous (IV) infusion. Rocuronium is typically administered through an IV infusion. The dosage and duration of treatment depend on the specific procedure, patient characteristics, and the need for muscle relaxation. Anesthesiologists and healthcare providers carefully determine the appropriate dosage. Considerations and monitoring. When using rocuronium, certain considerations and monitoring are essential. Precise dosage. Rocuronium should be administered with precision to achieve the desired level of muscle relaxation without causing excessive paralysis. Reversal agents. Similar to other neuromuscular blocking agents, rocuronium-induced muscle relaxation can be reversed using specific agents like neostigmine when it is no longer needed. In conclusion, rocuronium is a valuable medication in neurology, anesthesia, and critical care. It plays a critical role in achieving muscle relaxation during surgeries, medical procedures, endotracheal intubation, and mechanical ventilation. The precise use of rocuronium is essential for patient safety and comfort during these interventions. Thank you for joining us on the Neurology channel. If you found this video informative, please give it a thumbs up, share it with others who might benefit, and don't forget to subscribe for more valuable insights into the world of neurology and brain health. Stay well and take care.